In comic books, there are superheroes who can come back from anything. For example, the anti-hero Deadpool has regenerative abilities after going through a very painful transformation to try and get rid of the cancer he had. Another example is the Inhuman Mystique. She is a mutant who can change her appearance at will. She can rearrange her organs to prevent injury that could kill her. As of now, humans can't begin to comprehend or compare to these imaginary beings. However, we are on the path to get there. Using research from 3 different TED Talks, there is evidence that we can prove that we aren't that far behind from being able to do this. Catherine Settler gave a TED Talk about finding a new way to help cells regenerate. In her TED Talk, she talked about the helper T cell. The helper T cell is extremely important for wound healing. The T cell helps suppress and regulate immune responses. The importance of having the helper T cell is shown in HIV, a virus that primarily affects the CD4 T cells. In more advanced stages of HIV, loss of the T cells can lead to a stage of infection known as acquired immunodeficiency syndrome, or AIDS. Not only do they help activate B cells, secrete antibodies and macrophages to destroy microbes, they also help activate cytotoxic T cells, which can kill infected targets. When a patient has AIDS, their T cells cannot protect their body from microbes that are normally harmless. The helper T cell isn't the only thing that has helping the body heal faster. In Molly Stevens' TED Talk, A New Way to Grow Bone, she tells us about the different materials we can use to create bone. One thing that is very important when contemplating growing bone is that you have to remember that the material that you grow cells on will dissolve away after time, unless we develop a new material that won't dissolve. If you think about the different types of tissue, you realize that they all grow back differently. Take, for example, the human liver. Someone can remove half of their liver and it will regenerate in a nice, clean way, meaning that it won't have a lot of scarring. On the other hand, when you get a tiny nick in your cartilage, you'll find that it is very difficult to regenerate it. Bone is in between cartilage and liver. For example, a surgeon might take bone from your iliac crest and then move it to somewhere else in your body. This works well because it is your very own bone and it has a strong blood supply. Unfortunately, there's only so much bone you can transport before you don't have any left. This brings up the typical tissue engineering approach. Surgeons harvest cells from the patient, then they put in some really fancy chemistries and you can culture scaffolds in the lab. But by focusing on the simple material system, people can generate enormous amounts of bone. They use the body as a catalyst to help make the new bone. This approach is called the in vivo bioreactor. By using this technique, they are able to create large amounts of bone. Us humans have a layer of stem cells wrapping around the outside of our long bones, such as the femur and the tibia. The layer not only has stem cells in it, but it is normally extremely tightly bound to the underlying bone. The stem cells wake up if you have a fracture to help repair the bone. In order to take the periosteum layer, they have to inject a liquid underneath it. This liquid, within 30 seconds, the liquid turns into a rigid gel and they are able to lift the periosteum away from the bone. This then creates an artificial cavity which is right next to the bone and a rich layer of stem cells. To be able to access the stem cells, you go in through a pinhole incision so no other cells will be able to get through. In the in vivo bioreactor cavity, the in vivo bioreactor cavity can then lead to the proliferation of stem cells. They form new tissue, and over time, the doctors will then be able to harvest that tissue. We know that as the cells in the embryo and the body develop, they can form a new form of tissue. They can form a different kind of tissue. cartilage. So in order to get 100% cartilage, you have to develop a gel that is slightly different in nature and slightly different in chemistry. Make sure that you have enough information to do this, to get the cells to do what you want, but not so complex that you can't get it in clinic. You really have to try to understand the structure of the tissues in the body. What's really nice is that the bone structure is beautifully organized. It has lots of blood vessels, and the cells are actually surrounded by a 3D of matrix nanoscale fibers. The material is a hybrid of a part organic and part inorganic. The scaffolds are made very porous in order for blood cells to grow there. Pores are made much bigger than the cells, so even though it is 3D, the cell might seem as it's a more curved surface. One thing you can do is thinking about surrounding your cells in 3D and give them more information. After creating this technique, there has to be a way to apply it to cardiovascular disease. If you have a heart attack, the cells and tissues die over time. It would be great if there was a way to get to stop the tissue from dying, or at least find a way to help it regenerate. Even though there are a lot of stem cell trials going on worldwide, there is one common factor. It's that the cells die after you implant them. It seems as if they can't get the right amount of cells to the location and have them deliver the beautiful right regeneration that they would like to happen. Many people around the world are trying to accomplish the same thing, but we still need the chemistry, mechanics, and interesting topography and ways to surround the cells. Maybe someday we'll all be able to heal like Deadpool.